Dr. Schaffner, I want to thank you so much for returning because my audience was texting me and tweeting me and telling me they wanted to hear what you have to say about Americans likely to have at least one high risk factor for COVID-19 and flu. So thank you so much for returning.
So I'm good to be with you, Velder.
Okay, who are antiviral treatments recommended for? Can anyone take them? That's what we were talking about a little bit.
Well, anyone can take them, but the people we're really focused on are the people who are more likely to get severe disease and need hospitalization. That's older persons, people aged 65 and older, anyone who has an underlying chronic medical condition, heart disease, lung disease, diabetes is so common, high blood pressure, hypertension, persons who are pregnant, and of course, people who are immune compromised. All of those folks should really contact their healthcare providers very quickly after they become ill to take advantage of these antivirals.
Who's considered to be at high risk of more serious illnesses or hospitalization from the flu or COVID? Is there a group?
Yeah, there are people who are at higher risk. Of course, we all know that older people are at higher risk, anyone really age 65 and older. And then there are folks who have chronic underlying medical conditions, those who have heart disease, lung disease, diabetes, high blood pressure, things like that, people who are overweight, and then, of course, pregnant people, and also people who are immune compromised. Excuse me for a moment.
God bless you. Can you explain how antiviral treatments are working?
Yeah, what the antivirals do is actually interfere with the ability of the virus to multiply. So they reduce the amount of virus that's in your body, and therefore your own immune system can cover that and help you recover more rapidly from the illness.
I want my audience to know I'm talking to Dr. William Schaffner. He's talking about antiviral treatments that are effective. Dr. Schaffner, let me ask you this. In a local, retirement home, I was told that they are fighting COVID. Are we in that season now?
Well, we're certainly in that season now, Velder. We have a big increase in influenza, and COVID is also increasing. And so both of these infections are out there. They're infecting people very, very commonly. You can tell them apart by testing. And then once you've got that positive test, my goodness, call that healthcare provider and get yourself some treatment with these antivirals. They will reduce the duration and the severity of your illness.
Now, these prescription medications and studies show that they are highly effective. Are they being used as often as they should be?
Well, I wish they were being used a little bit more frequently. And that's why we're working with people such as yourself to get the word out so that the general public is more aware of it. And we're also letting doctors know that these are very effective treatments for these high-risk individuals should they become sick. So the more we get the word out, I think the better we'll be able to treat people with these illnesses.
Okay, do you have an opinion on what's keeping physicians and healthcare professionals from prescribing antivirals for patients? Do they know something we don't know?
No, I think one of the things is that patients, particularly we adults, call doctors pretty late in our illness. We tend to put it off. We hope we'll get better tomorrow rather than bothering the doctor. And so the later it is, the doctors know, the less effective the medicines are. But on the doctor's side, we need to get more information out to them so that they are more assertive and more likely to use these medications in high-risk populations. So we're trying to educate both the general public and doctors that we can really reduce the severity of these illnesses as they occur in high-risk patients.
My audience is the perfect audience to talk to this, Dr. Schaffner. they are people called baby boomers, and you know that they're born between 1946 and 1950-something, I think. Anyway, they are most impacted by most of the medical conditions that come out. How can people be more aware and have access to these available antiviral treatments during any respiratory illness, this respiratory illness season?
Right. So baby boomers are getting older, they're maturing, and as that happens, it's just the way of the world, many of them pick up underlying chronic medical conditions. You can have a conversation with your healthcare provider, with your doctor in advance, and the doctor will let you know that as soon as you become ill, contact them and they can prescribe a medication for you. Sometimes doctors actually do that in advance. They actually give people in high-risk conditions a prescription, you get it filled, you have it at home, and the doctor will say, the moment you become sick, start the medication. And that works very, very effectively.
As I wrap up with you, I'd love to know what resources are available to help those who are interested in learning more about the antivirals, and where do they go for more information?
Well, they can go to nfid.org and vc.org also.
Dr. Schaffner, this has been a very, very important conversation. So I want to thank you so much as the past medical director of the National Foundation of Infectious Disease. I know you've done some great work, and I want you to thank you for stopping by the Valder Beebe Show. I really appreciate it.
Thanks for your kind words.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.